in Europe. I'm Dana Lewis, the host of Backstory with Dana Lewis Podcast. You can check us out on any platform where you listen to our podcast or where you listen to podcasts, Google, Apple, Stitcher, you name it. Across Europe right now, here's what's happening. I mean, governments, I think, are starting to panic. Intensive care units, for instance, in Paris, will be packed with COVID-19 patients as soon as next week. We are expecting an address by President Emmanuel Macron to France tonight, talk about what kind of measures he is going to take. People are reporting that he will stop short of a national lockdown like the ones that they had in the spring, but they will bring in some new restrictions. And here in the UK, major disagreements what to do here, as the number of deaths have now doubled in just 1 week, week on week. And I want to talk about all of this with Joe Phillips.
Hi, Dana.
So look, let's go back to, the spring and when the government was being harshly criticized in the United Kingdom. And they started to say that we're just following the science. And now it would appear that they're not following the science at all. Can you bring us up to date on what's happened between the scientific advisors to the government and what they've been recommending and what the UK government of Boris Johnson is in fact doing?
Okay, so what we have is a complete split between the government and their scientific advisors. As you rightly say, the message from the spring was, we are going to be governed by the science. We will take the scientific advice. That eased quite a lot as the lockdown eased during the summer months. But what's happened this week is that Boris Johnson went on TV earlier in the week to announce a rather complicated, convoluted, as is his way, three-tier system of lockdown in parts of the country. So this is for England only, not Wales and Northern Ireland and Scotland. We'll come on to those in a minute. In an unprecedented move, later that same evening, the scientists who are members of the Scientific Advisory Group released the minutes of a meeting that took place on September the 21st, when they were urging the government to go for a lockdown, a national lockdown, to create what is being called a circuit break. This has been going on for quite a long time, because at the moment you've got large cities like Liverpool and Manchester and swathes of the north of England under much stricter lockdown. You've got figures rising, another nearly 20,000 cases today. That's 2,500 up on yesterday. And what you're seeing also is a complete split between the government at Westminster and the devolved powers. So this afternoon...
All right, so before we go into the devolved powers and the problems with Northern Ireland and Wales and Scotland, because it's very important what's going on. In Liverpool, where they are now bringing in new restrictions already, where they are telling people no longer will pubs even be able to stay open until 10 o'clock. I mean, they are essentially taking us back to March, are they not, where they are going to, close schools, close pubs, close restaurants, unless it's takeout or something, and essentially shut businesses down again when...
Yes, and of course, this is the problem, and this is the problem that's facing governments around the world. Well, it's the problem of weighing up, economic recovery, which is very fragile, and the public health risk. Now, it is quite clear, I would have thought, to anybody with half a brain, that if you suddenly let people start going out, socializing, going to pubs, traveling around, and there are very few restrictions, you are going to get an increase in infections. That doesn't necessarily mean that those figures are translating to the number of people in hospital. But of course,
but hospitalizations are starting to go up, and they're starting to open these major emergency hospitals across England again, across the United Kingdom.
Nightingale hospitals. So they're putting those back on standby. They're expecting a sort of a 2-week lag. So within the next couple of weeks, there will be more hospitalizations. But we've got, students back at university, kids back at school, some businesses open, people not socially distancing. And if you bring in some crazy rule like let's close pubs and restaurants at 10 o'clock, you're then going to crowd the streets with an awful lot of people all together, all looking for a cab to get home or to get onto public transport.
All right, can you take me back a little bit to how we got here?
Do you know? Yeah, that's exactly what he did. In fact, about 10 miles from where I'm sitting right now, there is still a piece of graffiti on a wall outside Canterbury, city in Kent. And it says, "Lock down now, Boris." Now, you know, if we cast our mind back to March, there were people him to lock down before March the 23rd. He was too late. He did it. He didn't want to upset people. Boris wants to be liked. Don't let's forget this. But his default position is he wants to be popular, and he hasn't got the attention to detail to make difficult decisions. So we went into lockdown late, and then, as you rightly say, Dana, he lifted the restrictions far too early. People were travelling hither and yon, and of course, everything was spreading. And in the meantime, during the tight lockdown period of the spring, very little was done to actually put in place an effective track and trace system. Now, what we've got in the UK is a track and trace system that, frankly, you and I could do on the back of a fag packet with a couple of paper clips and an old toilet roll, because it's not working. It's run by a friend of Boris Johnson's, a friend of the former Prime Minister.
Yeah, I mean, I think it's fair to say that track and trace has been a phenomenal, tragic failure here, where I understand even in the north of England, in fact, they started giving out test kits this week, and they made the mistake and they gave them used test kits, recycled. They weren't recycled. They had taken in samples and then they redistributed them by mistake to people who got other people's samples. It didn't. Some of them were reused and some of them were sent back right away.
Yeah, I know. So, you know, you can't have any faith in them. And throughout this, the government has been looking to lay the blame at other doorsteps, if you like. So they've now got this track and trace body, the board of which has got no public health expert on it, has got no GP, no nurse, no behavioural scientist, no epidemiologist, no data scientist. A lot of people who come from business, like Jaguar Land Rover. And
Can we talk about what they are doing? And maybe in fairness, you know, I'm gonna say that maybe the government's doing the right thing, because all governments are struggling with this right now. So what you have the opposition leader here, Keir Starmer of the Labour Party, who has come out today and said, "National lockdown. What are you waiting for? You're making a mistake. Shut everything down for 2 weeks because it's the school break coming up right now in the UK anyway. Shut everything down and let's do the circuit break." And Boris Johnson, the Prime Minister, saying, "Well, wait a minute, you supported us doing kind of regional closings and early closings of restaurants and limiting people to groups of 6 before, and now you're turning on us for political purposes." Is Keir Starmer, do you think, turning on Boris Johnson for political purposes, or does he see this inevitable anyway, that in fact this is what's going to happen?
I think Keir Starmer is responding to the minutes of the meeting, the SAGE meeting in September, that were released by sizing the government. And I think he's responding to the fact that it is now very clear that the government is not being guided by science. It is, you know, ploughing its own furrow for who knows what reason. Of course, you can say it's easy to be in opposition and say how you do it. People did back things getting back to normal because heaven knows, you know, we're all fed up with the restrictions. But when it is clear that the restrictions are not severe enough and that the infection rates are going up, and you have been advised by people who are crunching the numbers, looking at the figures, and you ignore that advice willfully, then I think Keir Starmer is absolutely right. And
Well, I mean, there's a lot of people, Joe, that would argue that what Boris Johnson's doing is right because, by closing restaurants and pubs and businesses that have only just opened up again, that you're kind of putting a fatal bullet in the wounded. I mean, these people are already struggling, and there is no clear statistics that have been released from any of these committees that really tell us where is COVID-19 beginning and spreading from. Is it from the pubs? Is it from the schools? Where is it coming from? And so a lot of people are saying, until you release the numbers, how can you come up with this kind of, whack-a-mole strategy where you close one city down and keep another one open and et cetera?
Well, exactly. But that then goes back to the track and tracing. If you haven't got a track and trace system that is working properly, that people have faith in. I mean, I know many people who won't download the National Health Service app, which you can use, scan a QR code when you go into a building or a leisure centre or a shop or something. They won't do it because they don't want to be told, oh, you were standing to somebody in a queue in a supermarket who's subsequently been tested for COVID,
right.
You need to isolate. So you've got a problem of there's a lack of compliance, but the lack of compliance comes from a lack of confidence, and the lack
Absolutely. There's a huge lack of confidence in what the government's doing here. Look, can we just explain what they are doing to people who are not in the UK and don't understand this? People in the UK don't understand it either. But essentially, they are taking regions where the numbers are higher, and they're closing them down for how long?
They're closing them down, for the foreseeable future. But there is no evidence that backs any of the decisions that they're making. So they're closing
Right.
pubs, restaurants in the northeast of England and the northwest of England, but there is no evidence to say that's where the new figures and the infection rates are coming from.
Well, they do see higher infection rates in places like Liverpool that are being shut down.
But they're not seeing them coming up. But the other thing is there have been quite strict local lockdowns in other places, in the Midlands and the Northeast, where infection rates are still rising. Now, we know that in some of those areas, that is because there are houses of multiple occupation, multi-generational households. We know that COVID spread very quickly through overcrowding, in poorer areas. This is the same across Europe. That's why we've had the protests in Madrid, that people in the poorer areas think that they are being disproportionately penalised and punished, if you like, but they've got nowhere to escape from it. So there's nothing evidence to show local lockdowns at the moment have worked, and there is no evidence to say that the current plans by the government, some idea that Boris Johnson cooked up because he's too frightened to say, right, let's do it. I mean, just to go back quickly, Dana, to the point about statistics, there is a body of thought and a scientific thought, 2-week break. You're not going to stop people dying because, all you're doing is postponing it. But what you are doing is giving a breather, which allows hospitals and medical services to be ready to cope with what will be the inevitable rise in hospitalizations. I mean, don't forget, many of the people working in the health service have already had one hell of a year, right through the spring, working flat out, and now they're facing, a ghastly autumn and winter.
All right, if you're just joining us, I'm Dana Lewis with Backstory with Dana Lewis podcast, and with me is Joe Phillips, a commentator here in the UK. That have been locked down and are facing different.
Well, it is the disunited. going through the roof, because the leader of Scotland, Nicola Sturgeon, who is Scottish nationalist, she's very clear. She makes tough decisions. She explains why, and she makes it absolutely clear.
It has a lot of confidence. So what's happening very quickly? Let's just run down the list. What's Northern Ireland doing? They are completely taking a circuit break and locking down everything.
Yeah, they're closing schools from Monday for 2 weeks, so that extends the half-term break by an extra week. They're closing all restaurants and hospitality. Some retail is allowed to stay open, and they're allowing some gyms to stay open, but only on a sort of a one-to-one basis.
Scotland.
Wales is going for the same sort of thing, but
Okay,
Wales is a step further, and is in the last hour or so has announced that they are not going to allow people to visit Wales who are travelling in from the so-called hotspots of the north of England. Scotland, we expect, will make an announcement later on this week on further lockdowns in Scotland.
Yeah, is that not the most unprecedented thing you've ever heard of? That in a United Kingdom, a borderless United Kingdom, that Wales is saying nobody from England proper can come, and it's very political, and
yeah, completely unprecedented. And the way this government is going, Boris Johnson is going to end up being the Prime Minister not of the United Kingdom, but of a very small area around the M25, at the large awful motorway that goes around London, because everywhere else is disintegrating. Don't forget that you've also got in a lot of these regional cities that we talked about earlier, like Manchester and Liverpool, you've got regional mayors who have quite a lot of power. And earlier today, haven't been doing, and also to give them the powers to make their own rules, so that they can go around and they can close pubs and restaurants and bars that are breaking the rules, rather than leave it all to this Westminster thing. So yeah, it's unprecedented. I mean, we're watching the breakup of the United Kingdom. We've got a
Joe, how does this end now? Because they are not getting the numbers under control. If you're just joining us, we've been talking about how COVID-19 rates are suddenly rapidly going up in Europe. People are worried about hospitals being over. The opposition seems to think that this is just not going to end well, and it's inevitable. We are going to have to go through another full lockdown in the United Kingdom, while America, lets COVID run wild and run hot.
But hey, Donald Trump's had it. He's cured. Look at him. He's 20 years younger.
Oh, he sounds like a lunatic. But here, do you think we're going to have a full lockdown?
Yeah, I do. I think maybe not for so long, but there is a point now, and I think just talking to people generally, the general public and people that you talk to, they think it's inevitable. So actually, do it now. It's like ripping off the Band-Aid. Do it now. Do it quickly. As you said earlier, over that half-term break with the schools on holiday, just do it. See what happens. Because if you can lock down strictly, yes, it's really tough for businesses, but it's going to be equally tough for businesses if in 6 months' time, we're still not back to normal. And I think people are getting to the point where they can't see an end to this. I mean,
I'm not convinced. I have to tell you that I'm as confused as anybody, but my kids are in school. They go on term break next week. There's no COVID cases in their schools that we know of. Businesses in London, people I know that are working in numbers, and people are working, blue team, red team, and not entirely going back into crowded offices, and they're working in bubbles. I mean, a lot of that seems to be working. I mean, the London numbers are not out of control yet, but they do seem to be out of control in Northern England.
Well, yes, and this is the problem, that for a lot of people, their daily experience is exactly as you said, that life is carrying on. It's a new normal. It's a different normal. We're all having to wear masks when we go shopping and go out and all the rest of it. But actually, yes, everything is carrying on, and kids are at school, are at university, some businesses are open, obviously not theatres and cinemas and places like that. But yes, and I think there is a growing feeling amongst many people who either have not heard of anyone who's had it, or know people who've shown no symptoms who have been diagnosed as having COVID-19. And this, I think, is where the confusion lies. You know, I was talking to a bloke a little while before I came on air this afternoon who'd got some friends who were going off on holiday. They had to do tests 48 hours before. 2 of them tested positive with no sign, no illness whatsoever.
Really?
So the things that is coming through on this, that whilst the infection rate or the number of cases is going up hugely and rapidly, and yes, there is a level of hospitalization, but it is not at the same level and the same desperate level of people in ICU, intensive care, that we were seeing in March and April. So either we've got a lot of people who are testing positive but are asymptomatic, but clearly can be infectious.
I assume they canceled their trip, did they?
Apparently, yeah. Yeah. Very
I'm just seeing one of the comments here. It says they hope that the media doesn't spin it, bad media people that we are, they don't spin it and blame the economic crisis on Brexit. We're not blaming this on Brexit yet, are we? That's another economic crisis that's coming.
Another one that's coming around the corner, and that's another. You know, Boris Johnson, if he'd got any brains or any brains around him, would say, right, we really need to deal with this pandemic, because in a few weeks, economic juggernaut coming towards us with no brakes. So, you know, you add that to the pandemic and all the chaos that will come from Brexit. Why on earth a little bit more masterful, say, right, it's a tough decision, nobody wants to do it, but we're going to close things down for 2 weeks. Every 2 weeks, we're going to see what happens. But get the track and trace sorted, because otherwise, nobody has any faith in anything that the government does. And that's his big. Yes, a short. Yeah. Yeah, I do. I think it's inevitable, because I think there are so many people caught that I think, you know, them wait until January when it's really cold and grey.
People are saying that, you know, it's easy to talk about lockdowns if you have some money in the bank, but the government has really not come up with a good plan for bailing out businesses. And if you're forcing them to.
And that's a problem. Absolutely. And that's another thing that is, again, part of the confusion, that if you are only advised to close as opposed to forced, you don't get any government benefit. So it depends what tier, 1, 2, or 3 you're on. So, you know, if you're running a pub in Liverpool, you might be on tier 3, but you've still got to pay your staff, and you're not going to get the same benefit of government. I mean, you know, we are.
And the most they get is the 75% or something of the salary. They don't. There's no. They're not compensated 100%, or they're given £3,000 for a month, an immediate payout, which, you know, I've heard pub owners say that's nothing. It's not going to carry them for a few hours.
Well, and the trouble is that, you know, people might be getting paid 80% of their wages, but they're not being able to pay 80% of their rent, or 80% of their electricity or gas bill, or 80% of all their other bills.
Yeah.
And this is the problem. So, you know, in a way, it's clearer if you say to people, right, everything's closing for 2 weeks and everybody gets paid. I mean, you know, we're borrowed up to the hilt anyway, so it sort of doesn't make a difference, because.
Well, you may get your wish the way things are going, and this government doesn't seem to know which way it's going. But I think if the numbers keep going up, it will be a national lockdown. So, Joe Phillips, our guest commentator, thank you so much for all of your your input and your ability to bring all of this together, because it's very multi-layered in the UK right now, and it's confusing for a lot of people even living here. So thank you for all of that. And I'm Dana Lewis, the host of Backstory with Dana Lewis podcast. Check out our podcast, and we hope that by listening to broadcasts like this, you get a little better sense of what's happening in Europe as well with COVID-19, as we all try to face this beast of a crisis that just will not go away through the winter time. Thank you, Joe.